Hello and welcome to Lecture 1 in the Inform Africa training series. In this session, we'll explore the relationship between human mobility and epidemics, a foundational topic that connects transportation systems with public health outcomes. This lecture is part of the Inform Africa project, supported by the NIH-funded DSI Africa program, which brings together researchers, institutions, and data to improve health outcomes across the African continent. We are speaking from Villanova University's Department of Civil and Environmental Engineering. I'm Dr. Xin Wu, and together with Dr. Chenfeng Xiong, we'll introduce how mobility data can help us understand and model epidemic spread. Let's start with the objectives of this training. By the end of this session, you should be able to understand the fundamentals of transportation engineering and their connections to public health. We'll explore the human mobility data repository developed by our team, recognizing its data structure and potential applications. You'll also gain hands-on experience with geographic information systems, particularly QGIS and Kepler.gl, to visualize and analyze spatial data for early insights into mobility and disease patterns. Beyond technical skills, this program emphasizes interdisciplinary understanding, bridging transportation engineering and public health domains. We aim to build a data transfer platform between the Institute of Human Virology in Nigeria and our Villanova research team. Through this collaboration, we hope to establish a continuous improvement feedback loop, one that strengthens future training and fosters new research partnerships under the Inform Africa framework. Here we can clearly see how human mobility and epidemics are deeply interconnected. On the left, the example highlights the efforts of African doctors and public health institutions in ensuring equitable vaccine access during the COVID-19 pandemic. This reminds us that mobility is not just about movement, but also about access to healthcare, vaccines, and essential services, especially in underserved regions. On the right, we see a visualization of the global air transportation network. Each node represents an airport, and each link represents a direct connection between airports, about 4,000 airports and 50,000 flight routes worldwide. Every year, over 3 billion passengers travel through this network, covering more than 16 billion kilometers each day. This immense connectivity is what allows diseases to spread rapidly across continents, but it also enables global cooperation, the delivery of medical supplies, and the sharing of resources. So, understanding these mobility patterns is fundamental to epidemic modeling and response planning. During the COVID-19 pandemic, one of the most critical tools for tracking mobility changes across the United States was the COVID-19 Impact Analysis Platform, which introduced the Social Distancing Index, SDI. The platform was developed by a team led by Dr. Chenfeng Xiong, whose members are now at Villanova University during his tenure at the University of Maryland. The SDI integrates several mobility-related indicators, including the proportion of people staying home, reductions in work and non-work trips, and decreases in travel distance and cross-county movements. A higher SDI value indicates reduced mobility and stronger social distancing behaviors, serving as a key measure of the public's response to pandemic-related policies. This slide continues our discussion on the COVID-19 Impact Analysis Platform and shows how human mobility patterns changed during the early months of the pandemic. On the left, we see a heat map of the social distancing index across US states from February to April 2020. Each X indicates the date when a state issued its stay-at-home order. You can observe 5 phases, from pre-pandemic mobility to behavioral change, followed by government mandates, a period of quarantine fatigue, and eventually partial reopening. The shift from red to blue shows how mobility dropped as people stayed home and travel decreased. On the right, we have time series plots for selected states. The blue lines represent the percentage of people staying home, while the red lines show the number of new COVID-19 cases. As restrictions increased, mobility declined, but once fatigue set in, people began moving again, often before case numbers had stabilized. Together, these patterns highlight a key insight. Human mobility directly influences epidemic trends, and even small relaxations in movement can quickly change infection trajectories. As a result, it is important to develop an overall modeling framework connecting mobility data with epidemic simulation. On the left, we see the 3 main components. First, data integration, which combines the mobile phone data, geographic mapping, and seroprevalence surveys. Second, the modeling approach, which uses traffic demand modeling and calibration to represent both movement and disease spread. And third, the simulation system, which predicts virus transmission by simulating person-to-person interactions within a transport network. On the right, the flow diagram shows how this framework operates, starting from macroscopic travel demand modeling down to microscopic daily tour identification, then assigning agents to networks using geohash-based mapping, and finally running agent-based CR simulations. Together, these steps form an integrated system that connects how people move with how diseases spread, bridging transportation engineering and public health. This training program aims to introduce the mobility data foundations to develop the above modeling framework. Specifically, the aim of this training is to introduce the fundamental data inputs, location-based service (LBS) data, as the foundation for epidemiological research, and specifically to develop off-the-shelf tools for public health crisis monitoring and prediction. The broader vision is to apply mobility data to create readily deployable tools that can support timely responses to public health emergencies. That's where location-based services, LBS data, come in. LBS data provide fine spatial granularity, even down to neighborhood or building scale, high temporal resolution, and large-scale coverage when properly sampled. This is what we will include in the iTraining series. This training series will emphasize understanding the basic knowledge of location-based service data as a powerful means to capture real-world human mobility and enhance the accuracy of epidemic modeling. On the right, we illustrate a broad vision that integrates multi-source data, from travel surveys and mobile data to behavioral and policy analysis, into a comprehensive framework for modeling human mobility and public health. Thank you for your attention. If you have any questions or comments, we'd love to hear from you. Please visit our website at inform-africa.org and feel free to contact us by email. See you in next video.